Hi, today I want to talk about all-on-4 dental treatment. So for those of you who don't know what this treatment is, essentially if you've got a really unhealthy set of teeth, what you can have is have all of the teeth removed, have dental implants placed and leave on the same day with a fixed set of teeth. Sounds a little bit too good to be true, right? So let's break this treatment down, let's understand what it is and see if there are other options which might be a better fit. So first of all, let's understand what this all-on-4 treatment is. And all-on-4 was developed by an implant company called Nobel Biocare, and according to their website, the first treatment was done in 1993. And essentially what happens is all of the teeth are removed and then implants are placed, usually between 4 and 6. I've seen people do it with 8 implants. And these implants are all placed on the same day as having the teeth removed. And then a lab technician comes and makes you a new set of teeth which fit into the implants which you've just had placed. And then you leave the surgery. This treatment takes about a day, by the way. And then you leave and everything is left to heal and integrate, and 6 months later you come back once the gums and bones have all settled and then have a final set of teeth made. Now, I've provided this treatment for a fair few of my patients, but I'm kind of steering away from it because I personally feel that there's a lot of risks which can be avoided. Now, it's clear the main reason that people love this treatment as in terms of patients is that it's all done in one day. And quite often the people who have teeth which are unhealthy or a really unhealthy mouth have an underlying phobia of going to the dentist, and if they can have all of their problems solved in one day, that's an amazing proposal. But doing everything all in one day does increase the level of risk because you're trying to get every one of these tiny little processes perfect and all happening in one day. Let's look at what happens when you take a tooth out. So everybody knows that when you have teeth removed, the bone underlying is going to change shape. And to demonstrate this, let me show you a photo of someone whose teeth are removed about 3 months ago. So this is what it looked like when she came in, and the situation here is that 3 of these teeth need to be removed. And they need to be removed because there is an infection underneath them which you can't see on the photo, but you can see it on the x-rays. And actually one of these teeth, from memory, I think is broken as well. So these teeth needed to be removed, but the problem is the teeth are supporting a bridge, which means that actually all 5 of these teeth need to be removed. So what we did, we made a denture, a removable denture, the thing that people hate. We made that to be fitted on the same day as removing the teeth and cutting the bridge. So this is what it looked like on the day, and it doesn't look too bad, right? And remember, we could have placed implants in at this stage, but it's good to let the bone heal and understand exactly what you're left with. 3 months later, this is what it looks like, and you can see how much bone has actually been resorbed. We call it resorbed when the bone gets eaten away. And compare this to the other side, which is the natural set of teeth, and the side where we now have to put implants. Losing this bone has massive cosmetic issues, but I'll make a different video about this case and in another day once I completed it. But I just want to show you that when you take teeth out, even teeth which are unhealthy and have lost a lot of bone around them, that you do get a lot of the changes in bone straight after tooth extraction. Now, it used to be thought that if you put an implant in straight away, that it stops a lot of these changes. But more studies have been carried out in this field, and actually putting an implant in has almost zero effect on what the actual bony change is going to be. So that's my issue number 1. We're putting implants in a jawbone where we don't actually know what the final landscape is going to be like. So let's look at the second stage now. When we take the teeth out, we want to be able to put the implants in straight away. And the reason that most people have a mouth which is in this condition is because of one of two things, either tooth decay or gum disease. Both of these things are caused by bacteria. And when you take the teeth out, these harmful bacteria are still in the mouth. The mouth has got loads and loads of bacteria, but there's a certain kind of bacteria which cause gum disease. And these are surrounding the teeth when you take them out. And now we want to put implants into these infected areas. So it's logical to think that putting implants in a sterile area is a much better thing than putting implants into a tooth socket which has been infected with gum disease. So that's my second issue with this. And my third issue is a little bit more of a logistical issue. In my personal clinic, I'm booking probably about 2 to 3 months in advance. And when I see someone for a consultation, if they want this kind of treatment, it means that I need to find a day where I literally have nobody else booked in. And that can be 2 to 3 months down the line. Not only that, we also need to find a day when the lab technician can come in and they need to have a day off as well. And my patient needs to have a day off. So by the time all three of us are coordinated, it can be many months down the line. And if we need to consider sedation, then that's going to add an extra complication into the whole thing. So in reality, coordinating all of these people together can be a bit of a task. Now, saying all this, there are loads of dentists who are providing this treatment and they're doing it really well, and it seems to be working really great for them. But in my experience, the only time I've had any kind of big complications is doing this kind of treatment. So it makes sense that if we can do everything in a more controlled way, then the long-term the success is going to be better. And I personally like to reduce risk as much as possible. It just reduces my stress massively. And I understand that my patients want to have fixed teeth in a day. So is there a way that we can have the best of both worlds? So this is what I tend to do. Step one isn't taking your teeth out. Step one is placing mini implants. Now, mini implants are just small implants like the name suggests. So what we do is we find little bits of bone where we can put these mini implants in. And these mini implants don't have to be perfect angulation or anything like that. Their only job is to hold a denture in position, okay? So what we then have is a removable denture made up to fit into 2 or 3 mini implants. That way we can remove all the teeth, have the mini implants clicking this denture in position on the day, and we can let all the areas heal up where the teeth were removed. This has a number of benefits. Number one, as a patient, you leave with fixed teeth on the day. Number two, where the teeth have been removed, we're now going to give them time to heal and let the bone settle into its final position. When this is also happening, because the teeth are the source of the infection in terms of gum disease, they're removed. All the harmful bacteria which is associated with the gum disease is also removed. Okay, that was benefit 3 included in there. So benefit number 4 is that we've got this temporary denture which we've made, this immediate denture. We can use this denture to kind of gauge what the final smile is going to be like, the final aesthetics, and then work backwards to get your implant placement in the most perfect position, and we can extend your smile as far back as possible. So another compromise with the all-on-4 kind of treatment is that you're limited in how far back you can take the implants. Your limitation is where your bone is. So if you've got a wide smile and you have large air sinuses at the back which aren't going to let the implants go all the way back, then you may be limited in how far back your final smile is going to be. And this means that when you smile, there may be gaps visible right at the back. So the way that the all-on-4 concept works is that the most posterior, the further back implants are angled forwards to try and get the last teeth as far back as possible. But the limitation is always the patient's bone. Now, because we've got this temporary denture, we can now assess how far back we need the last tooth to be, and then we can plan if we need to increase the bone further back to put implants right as far back as possible. This is the kind of stuff that you don't really know when you're doing the all-on-4 kind of treatment. And another massive advantage is that doing your treatment in short chunks like this means that you're not in the dental chair for a full day. These treatment sessions last from half an hour to a couple of hours if we're putting all of the implants in or doing bone grafting or whatever. And none of these appointments hurt. You're really giving a good anaesthetic. It's typical to get swelling afterwards, but you're going to get that with any kind of treatment. So now we've got these, what we call healed ridges. There's no bacteria which is causing gum disease. The gums are in their final position. We can then place the implants. We've got the implant positions perfect, and we can start rebuilding or building teeth on top of these implants. And the process of building the teeth is exactly the same as if you were going to do an all-on-4 treatment. There's a whole bunch of variety of tooth materials you can use, the kind of materials used to replace gum and all of these things. But I'll have to make a separate video all about that. Okay, so this is a massively complicated subject, and I'm no doubt really simplified it for the purpose of this video. Do see a professional if you're considering this kind of treatment, and it's always worth getting different kinds of opinions from different kinds of people, and you can find the kind of solution that fits with you. So I hope you found it useful. If you did, please give it a thumbs up, and thank you for watching.